Hey everybody, it's Joshua Goldstein, everyone's favorite acupuncturist, and today in my 6th video, I'd like to share with you a case of an occipital neuralgia pain patient that I had really good success with. Occipital neuralgia is a type of a pain that occurs when the occipital nerve gets inflamed or irritated, and it can cause all sorts of pain across the neck, down the shoulder, up into the head, into the ear, and into the jaw. I saw a patient with such a case 2 months ago, and he was complaining of occipital neuralgia in May of 2020. He noticed it in the morning because he would go to the gym every day, 5 days a week. This was his release. He works in banking and he also has children, and this was his way to get it all out of his system. He noticed that there was a pressure that had started to build in the base of the neck and started to run across the upper neck. And what happened was this pain would then shoot to the right side of the neck, causing ear ringing and jaw numbness. The pain was so severe he could not move quickly without feeling pain, and he had to stop all exercise and activity. He then saw a neurologist who sent him for a spinal MRI and for a brain MRI, and they were negative. He was then given the diagnosis of occipital neuralgia. He came in and he told me that he had done aggressive physical therapy 3 times a week for 10 weeks. His pain went down to like an 8, but he still was having pretty significant pain. He was using ibuprofen, 500 milligrams, 3 times a day to control his pain. And he had this very peculiar symptom that the pain would peak every 5th day to like a 15 out of 10. And this pain was just unable to be controlled, and it was really, really debilitating. He shared with me that this was really tough for me, quote unquote. This was really tough for me to give up exercise because I love my workouts. And he shared with me his fear of this becoming chronic. And this was his biggest fear. He had restricted himself from exercise, and he was doing limited yoga poses because of the pain. And he did walking and he did some spin classes. But he was pretty inactive compared to his previous workouts. So we treated him for 5 visits. On September 18, 2020, we used acupuncture. He sat there for 45 minutes while the acupuncture reduced the pain. He told me he felt no pain after he left. On September 21st, 2020, he came back and he did report that his pain went back up to like a 7 or 8, but it wasn't a 10. And that pain had stayed down. On September 30th, we treated him, and he felt the pain go down to like a 2 to 4, and he decided he was going to try to stop the ibuprofen and see how much relief he was actually getting from the acupuncture. And then on October 2nd, his pain went down to, again, the 1 to 4, and he had stopped the ibuprofen. Now, during that time, that 2nd week of treatment, he told me that the pain that came every 5th day with severe force was actually lessened. And October 9th, 2020, he was not getting that breakthrough pain every 5th day, and the pain was down to a 1 to 4. And he was starting to exercise again because he could move his head freely without getting shooting pain, numbness into the jaw, or pain into the ear, which caused him the ear to ring. There were 3 takeaways from this. 1, this is a phenomenal case. For people with occipital neuralgia, his success was rapid. And so that was really exciting for me. I love seeing people get better, and I have to give them a result or I don't continue treating them. He had a great result. Secondly, people want to know, how do I know if the acupuncture is working? So outside of total pain relief, one way to know is pain intensity. So after acupuncture treatment, if done correctly, you will feel less pain, or you will feel less pain the next day. This gentleman felt pain immediately. His pain did come back, but it wasn't at the levels that he had. So, for example, if we're treating someone for very severe pain, let's say the pain is a 10, and we treat them for a week And then in the second week, they feel their pain is now an 8 or a 6. Even though the pain is still coming back, the fact that that intensity of pain has dropped shows improvement. And then if we treat another week and their pain is down to 40%, that is showing significant relief and improvement. And eventually we get them to where there's 0 pain, or where the patient feels I can live with this pain. Try to get them to 90% because we want to get rid of that pain. Finally, he came in frequently. He came in at least twice a week, and that really made the difference. It's really severe pain sufferers, they sometimes initially start with 3. As they do better, we drop them down to 2 times a week, and then we drop them down further depending on how fast they respond. So as you can see, pain treatments are very individualized. People have different responses and respond differently to different types of treatments. I use balanced method acupuncture in my practice. I've been in practice for 23 years. I have an office here in Ridgewood, New Jersey. And if you'd like to talk to me about your pain or other problem that's bothering you, I encourage you to give me a call at 201-444-7150, or please check me out on my website at acupunctureyes.com. Thanks so much.